Now, the COVID-19 testing and vaccine program is facing even greater challenges. That's the concern of the Health Justice Initiative. It says the situation has been worsened by the unrest in Gauteng and KZN. The organization also says patients with comorbidities aren't being prioritized. Joining us now is head of the Health Justice Initiative, Fatima Hassan. Thank you very much for joining us. Now, firstly, we got that statement from the Gauteng government yesterday saying Gauteng has reached its peak because, of course, we're seeing the numbers go from your 13,000 to now just over 5,000. But are they jumping the gun? Because I would assume that because of the unrest, there hasn't been as much testing as there was before.
Thanks. So certainly there's concerns about a decline in people seeking testing or going to testing sites because of the unrest and the situation in the country. Obviously, there's concerns around safety, but I think people are also, have been extremely affected by the developments in our country this week. And there's so much uncertainty and lack of proper daily communication and information about which testing sites are open, which testing sites are safe, how we can get people in affected areas to facilities that remain open and that are safe both for testing and for vaccine administration. So there's a real concern around how we're going to mitigate the impact of the violence in these two provinces, both for managing the pandemic in a situation where we're in wave 3 and in a level 4 lockdown, in relation to both scaling up the ability of the country to test more people, detect and then do contact tracing, and then also to administer vaccines. I mean, we've seen reports that at least 19 vaccine sites have been closed temporarily, and we really need to, ensure that government works on a mitigation plan to make sure that they're either alternative sites or those sites reopen and they be open in a safe way.
Would people, for instance, be correct in assuming that there's no way we have gone over the third wave and gone over the peak because of the fact that people have gathered in large groups so much in the past week, and that was, of course, prohibited, and that is the way that this virus is spread?
Yeah, so, some of the experts and the health scientists and epidemiologists are obviously running the numbers again this week, and they'll have to do that the same next week. We have had reports of hospital facilities at the stretching point, both in relation to managing patients with COVID, but then also in terms of managing people who have been admitted who were injured in the violence. I mean, we've seen the numbers that the president announced yesterday of people who have also lost their lives. So there's definitely a double burden now on the system. We're not just dealing with the pandemic, we're dealing with the aftermath and the consequences of the unrest. We've also had reports that in some pharmacies that were looted, the vaccines were destroyed and they were stolen. In some cases, chronic medication, the supply of that has also been interrupted. So a number of alternative arrangements are being made by a number of different groups and organizations around the country to divert some of the chronic medication supplies. It does mean that there is a real risk that a number of people with comorbidities won't be able to access a regular supply of treatment in the same way that people are struggling to, for example, access food or fuel. It may situation may be less aggravated in the next few weeks, but it's certainly going to take time. And one of the greatest factors for in terms of influencing that is people need proper information, and they need to know what the plan is going to be now. If you're living with cancer in an affected area, what do you do next? Where do you go? Who do you call? Etc.
Fatima, while I ask you the next question, I just wanted to let you and the viewer know we have in a box now on ENCA the police minister, Begitele, visiting Phoenix, so I might have to cut us short so that we can go straight there. But I just wanted us to speak specifically about the death toll that is caused, for instance, by inequality in terms of, access to health in some parts of South Africa that obviously are still lagging, behind, compared to other provinces that at least, because even those provinces that have better health, there's still a crisis there. So let's talk a little bit about the inequality of vaccine, being able to actually get the vaccine, but also access to quality health.
Yeah, so I think it's a Unfortunately, it's a combination of the two because we live in a country with a dual unequal health system. The vaccine program is trying to actually, make sure that there isn't such a wide gap between the public and private sectors, but we've only vaccinated about 5 million people. I mean, it's a big step from where we were a few months ago, but we still have a long way to go. And what we are concerned about is that if there's been a disruption to the pharmaceutical infrastructure and medicine infrastructure in Gauteng and KZN, we don't want a situation where the other 7 provinces benefit from supplies while those 2 provinces are not. So in fact, you need a special plan now for the areas affected in Gauteng and KwaZulu-Natal so that you don't worsen the inequity. I mean, it doesn't help that it seems that only Pfizer is delivering vaccines on time and we just can't get any details from Johnson & Johnson. The introduction of millions of Johnson & Johnson doses into the system will be a tremendous boost because it's just a 1-dose vaccine and it could make administering the vaccine in multiple provinces, including the ones affected by the violence, much more simpler. So I think all of the inequality fault lines in our health system is coming to the fore now. And the last thing we want is for all the vaccines to be diverted to suburban sites or, only to private medical sites where only certain members of people in our country would benefit. That would be, increasingly unfair. So certainly we need a special plan to be made to make sure that people who are old, people who have comorbidities, people for whom vaccines are permissible and they're eligible in terms of the criteria in Gauteng and KwaZulu-Natal also benefit from this particular vaccine program. Otherwise, we won't be able to get out of this pandemic.
In terms of people with comorbidities not being prioritized, how did we come to that conclusion and how do we fix that?
So I think the way we fix that is, immediately government needs to issue a circular that all adults living with a comorbidity that has some kind of proof of diagnosis need to be prioritized and eligible for vaccination. It's really just scandalous that the health and medical community and the advisors to government didn't prioritize this sufficiently. We believe that there may have been advice given to government and that they did a U-turn in terms of prioritizing all people over 60 because they felt that the bulk of people with comorbidities are in that particular age group. It was then open to over 50s and now to people over 35. So the gap that we have is people who are under 35 or living with cancer, with TB, with HIV, with other chronic conditions really need to be prioritized because I think this week's developments has also created a further challenge for them because they really need to be able to access the vaccine so that they can cope with the way in which this pandemic is actually playing out. And this is why we're calling on government to release all of the expert advisories that it was given, the Ministerial Advisory Committee briefings that it received to see where exactly did government make a U-turn. Why did it make this decision? Based on what data and based on what expert evidence? We really need government to prioritize people with comorbidities now.
Thank you so much. As I told you earlier, we might have to cut this interview short, but thank you very much, Fatima Hassan from the Health Justice Initiative.